Bismillahirrahmanirrahim. Your Excellencies, First Ladies, Chairman of Mark Foundation Board of Trustees, Professor Frank Stengenberg Haverkamp, CEO of Mark Foundation, Senator Dr. Rasha Kellage, distinguished guests, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. A very good morning to you all. I'm delighted to be among you once again, as I did last year, alongside my dear friends, Your Excellencies, the First Ladies, as guests to take stock of the progress we have made in our joint programs with Mark Foundation and exchange views on their outcomes in our respective countries. I wish to congratulate all those who have been involved in successfully building Mark Foundation's global presence that we see today. As Mark Foundation enters their 8th anniversary and marks overall 13 years of conducting social development programs, our countries have, in more than one way, benefited from the Foundation's reputable expertise. I extend my heartfelt appreciation for the support. Ladies and gentlemen, I had the pleasure of welcoming Chairman Professor Frank Stengenberg Haverkamp and CEO Senator Dr. Rasha Kellage in the Maldives last month. We had a number of engagements to strengthen Mark Foundation's philanthropic work, supporting local policies and initiatives to promote the health and well-being of our communities. About 8 months on, since our first interaction in Tanzania last year, our collaboration with Mark Foundation has facilitated fertility and embryology training scholarships for our local doctors in the Maldives. These are two critical specialties where we currently face shortage of skills. We are also in discussion to facilitate the enrollment of our doctors in other critical specialties. Our collaboration during the past months have already established a strong partnership, and I'm eager to see through our initiatives under discussion. Rest assured, my full support to enhance the healthcare capacity in the Maldives, particularly because healthcare is a field I am deeply passionate about, having worked in it for many years prior to my current role. Apart from providing quality training for our doctors, nurses, and allied health professionals, the Maldives is focused on increasing access to healthcare for remote areas through the development of regional hospitals. We are eager to establish long-term technical partnerships to improve quality healthcare services across the Maldives. There's more room to work together, increase infertility and assisted reproductive service training, community-led awareness and infrastructure development, as well as cancer screening and related awareness building, developing mental health services, and capacity building targeted to increase women's leadership in the health sector. Ladies and gentlemen, I take great pride and privilege to serve as an ambassador of Mark Foundation More Than a Mother campaign. Through this campaign, a lot of work has gone into disseminating information to the public about the realities of infertility, providing a platform to share first-hand accounts, debunking myths, and removing the stigma surrounding it. This campaign also addressed other social and health issues, such as gender-based violence, that not enough people still talk about or act on in many societies. I believe that raising public awareness must be met with tangible, systematic action to eradicate them. Only then can meaningful change take hold. In the Maldives, for instance, a community awareness initiative was recently announced with Mark Foundation support. Under these initiatives, 8 different awards across 4 creative categories, media, music, film, and fashion design, are focused on inspiring and empowering our young talents to use their creativity, raising awareness about countering infertility stigma, preventing gender-based violence, women's empowerment, as well as addressing diabetes and hypertension, and promoting healthier lifestyles. We value in the Maldives the equal and essential role that women play in societies. We must never waver in recognizing women's unconditional dedication to ensure a good life for their children, husbands, and sometimes extended families, while at the same time contributing to nation building in their places of paid employment. We cannot discount these dual roles women play in both domestic and public spheres. We cannot ignore the fact that women make up nearly half of our population. For the same nature of work, it is only rational that we provide equal opportunities to thrive and compensation for their labor alongside men. The Gender Equality Action Plan currently in force in the Maldives has helped make much headway to institutionalize uplifting women to leadership positions, improving their access to finances and information for economic empowerment, addressing the prevalence of gender-based violence, and increasing women's access to justice. It has been enlightening hearing from my fellow First Ladies about various gender equality programs underway in their countries. I would like to share with you some key breakthroughs in the Maldives as well. The Fasha Mother Loan Scheme is one example of initiatives in the Maldives to empower women. Under this scheme, women entrepreneurs receive financial support, paving the way for greater financial independence and participation in the economy. The Maldives is working on making a full transition to digital services across the country. To accelerate this process and to do so efficiently, women, as much as men, need to be well-trained in essential digital skills. Our Empowering Women Entrepreneurs through Digital Transformation program with support from UN ESCAP has been of immense benefit towards our digital transformation goals. Additionally, our IBAMA mechanism, a UNICEF-supported community-based initiative that connects multi-sectoral service providers to solve multidimensional issues. Established in 17 atolls, this mechanism helps to prevent violence and injustice against children and vulnerable groups. We are working on expanding this network nationwide by next year. Preventing gender-based violence is among the very top of our social policies in the Maldives. A key highlight of strengthening gender-inclusive initiatives in the Maldives project with the Asian Development Bank's assistance is the establishment of the climate resilience shelters for GBV survivors. The project has been thorough success to reduce GBV and increase women's development. We are also working on developing guidelines with external technical expertise to improve gender-sensitive education and media reporting on GBV and domestic violence. The Maldivian society has historically been close-knit. Neighbors lent a helping hand, raising children, tending to the ill, home repairs, and so forth, all the while breaking bread, building communal bonds. I believe our Halukina program is rooted in the sense of kindred spirits. This community-led engagement interacts with local communities, hearing out common grievances and helping one another to overcome them. Ladies and gentlemen, I'm pleased to note that we have made significant strides in the Maldives to maintain a strong literacy rate for girls and boys. We believe that both girls and boys must be given the same opportunities to have an equal start in life. It is our responsibility as people in positions to influence to help children and young people reach their goals, their optimal potential. I'm encouraged to see an upward trajectory in equal access to education and literacy rates in other countries present here as well. In this regard, I would like to take a moment to appreciate Educating Linda program by Mark Foundation in collaboration with Your Excellencies, the First Ladies. The programs contribute to human development from a young age cannot be overstated. Education of countless students with immense potential but from disadvantaged background, has helped build change makers for tomorrow. Long-term benefits of the programs are guaranteed, and they cannot be undone. For education is one of the few things in life that cannot be taken away from you. Once you have an education, you can apply it for life, for the betterment of your families and wider societies. Ladies and gentlemen, during the past month, I have seen for myself the sincerity, dedication, and focused approach of Mark Foundation to drive tangible change. We are truly proud to partner with Mark Foundation and look forward to continuing our long-term partnership to bring meaningful benefit to the people and build a healthier, more empowered future for all. I thank you all.